Did you know that your body keeps a secret record of every infection it's ever fought off? There's a way to unlock this hidden history, and today we're diving into one of the most important clues, the Varicella IgG test. Whether you're preparing for a new job, planning a pregnancy, or simply curious about your immunity, this test can tell you if you're protected against chickenpox. Stick around, because by the end of this video, you'll know exactly what Varicella IgG is, when you need to get tested, and what your results actually mean. Let's start at the beginning. Varicella is the virus responsible for chickenpox, a highly contagious disease that most of us either had as kids or were vaccinated against. Symptoms usually include an itchy rash, fever, and fatigue. But for some people, especially adults, pregnant women, and those with weakened immune systems, chickenpox can lead to serious complications. Once you've had chickenpox or the varicella vaccine, your immune system creates antibodies to protect you from future infections. And this is where Varicella IgG comes in. IgG stands for immunoglobulin G, a type of antibody your immune system produces in response to infection or vaccination. So when we talk about Varicella IgG, we're talking about the specific IgG antibodies your body makes to fight the varicella virus. If Varicella IgG is present in your blood, it usually means one thing: you're immune. Either you had chickenpox in the past, or you received the varicella vaccine. So, who actually needs a Varicella IgG test? Here are some common reasons. Employment or school requirements. Many healthcare jobs and schools require proof of immunity. Pregnancy planning. Chickenpox can be dangerous during pregnancy, so doctors check if you're immune before you conceive. Travel to certain countries. Some regions recommend or require proof of immunity. Weakened immune system. If you're about to start treatment like chemotherapy, your doctor might check your immunity. Basically, this test helps answer one important question: am I protected against chickenpox? The Varicella IgG test is super simple. It's a blood test. A healthcare professional draws a small amount of blood, usually from your arm, and sends it to a lab. You don't need to fast or do anything special beforehand. Results usually come back in a few days. Let's break down what your results might mean. Positive IgG means you have immunity. You either had chickenpox or the vaccine, and your body has the antibodies to prove it. Negative IgG means you're not immune. You've likely never had chickenpox or the vaccine, and you may need vaccination to protect yourself. Equivocal or borderline. This means the results aren't clear, and your doctor may recommend retesting. It's important to follow up with your healthcare provider to interpret the results based on your history and health status. If you're not immune, the next step is usually simple: get vaccinated. The varicella vaccine is safe and effective, given in 2 doses, and it provides long-term protection. For people who can't get the vaccine, like those with certain medical conditions, your doctor might suggest other ways to reduce risk. Can you still get chickenpox after the vaccine? This is a great question. Yes, it is possible, though rare. Some people who are vaccinated may still get chickenpox, but the symptoms are usually much milder. That means fewer blisters, a lower fever, and a much shorter illness. This is called a breakthrough infection, and it's another reason why getting vaccinated is still a smart choice. It reduces the severity even if you do get infected. You might have heard of shingles and wondered how it's connected. Shingles, or Herpes Zoster, is caused by the same virus, Varicella-Zoster. After you recover from chickenpox, the virus can stay dormant in your body and reactivate years later as shingles. Interestingly, people who've had the varicella vaccine have a lower risk of developing shingles later in life. And for older adults, there's also a separate shingles vaccine to provide extra protection. There are some people who should not get the varicella vaccine, including pregnant women, People with severe immune system problems, like cancer or HIV, depending on the case, those who have had a severe allergic reaction to a previous dose or to components of the vaccine. That's why it's important to talk to your healthcare provider before getting vaccinated. They'll guide you based on your personal health history.
So whether you're getting ready to travel, starting a new job, or just being proactive about your health, knowing your Varicella IgG status is a smart move. It's a small test with big benefits. We hope this video helped clear up your questions about Varicella IgG, immunity, and the vaccine. If you still have questions, drop them in the comments. We're here to help. And don't forget, like, subscribe, and share this video with someone who might benefit from it. We've got more easy-to-understand health content coming your way, so stay tuned.